ഇതിന് പോകുക ஆடியோ யூஸ் பண்ணி விட்டீங்கன்னா ஆடியோ ரெக்கார்ட் ஆகும். புரியுதா போங்க? ஆடியோ வருதான்னு செக் பண்ணணும். அதான் சொல்றேன், எங்க செக் பண்ணணும் சொல்லிட்டேன். ஆடியோ ஓப்பன் பண்ணிக்க.
pioneered epilepsy and yoga research with Narayana Hridalaya Neuroscience Department, Bangalore, and established school-based yoga programs. He is setting up world's largest yoga and integrated medical center in Coorg, spanning about 300 acres. As a consultant physician and yoga doctor, Sir combines modern medicine with a holistic vision, treating physical. His dedication in evidence-based research and innovation approaches earned in recognition worldwide. Please join us in welcoming Dr. S.K. Shashikant sir. We welcome you, sir.
ಇಲ್ಲ ತಲ್ಲಿ
ನಾ ಬರ್ತೀನಿ ನಾ ಫ್ರೇಮ್
ಮೊದಲೇ சொல்லுங்க நான் ಫೋಟೋ எடுத்தேன்
ಅವರು வந்து ಅದೇ ನಿಮ್ಮ ಪ್ರಶ್ನೆ இருங்க சார்
Namaste and Vanakkam. So, post lunch, there is a good amount of food in the stomach. So, we have a nervous system, voluntary, involuntary. So, in involuntary, sympathetic and parasympathetic. Parasympathetic work is rest and digest. During rest and digest, stomach blood circulation is increasing. So there is a good amount of blood circulation here, so there will be less here. So in that regard, rather than giving you a lengthy lecture at this moment, I want to cut short few things. Very important things I will tell you. Post independence, we as an Indian scenario, we have dedicated more than 60 years for politics. Comparatively, another nearby country has dedicated around 60 years for education. So, we are the products of European Industrial Revolution, where every year XYZ amount of students will come out. With quality, without quality, we are not sure. Do you agree with me? Years of slavery, there is a subconscious slavery is left in our mind, where we are disconnecting from the roots. So we are not able to adopt the essence of spiritual essence in any medical science. So Ayurveda as the most ancient living science, and Siddhar. So the moment the word Siddha comes, Siddha is the person whose body, mind, spirit is aligned and enlightened. So I'll give one example, simple example. The Siddha doctors, those Siddhars, so they can comprehend matter dimension and get themselves connected with the non-matter dimension. Then for example, I am sitting and meditating in front of a tulasi plant, for example. So my views will be not just the physical eyes. My mind, emotions are balanced to the extent that my body, mind, spirit are aligned. And then I do the focus or dharana on that particular plant. And I connect in a particular way that my conscious mind will connect with the consciousness of the plant. So matter dimension, there is a connection between non-matter dimension, and then you get the essence of plant. It will be revealed to you automatically. On those ancient days where there is no actual chemical analysis, pharmacogenetics, nothing was there. During that time, how it was done is only through the essence of the astral travel or the prabhavalaya or an aura, extension of your aura towards that particular plant. That spiritual essence is missing day by day. So that's what I wanted to add. And few statistics are very important for you. On a global statistics, I'll take it, National Institute of Health, NIH, you can write it down, it's important for you. NIH states that 70% of primary physicians visit. When we visit first time to any doctor, 70% of the time, symptoms are related to stress. staggering statistical data indicates that stress is a major factor for psychosomatic symptoms. So 39 to 42% of people who are going for conventional means allopathy, conventional medical science, are trying one or other form of complementary therapies or alternative therapies. So that is the second statistic. So it means globally, India and China can contribute in a big time from the traditional Chinese medicine perspective, Ayurveda perspective or Siddhar perspective. If you have the knowledge of yoga, Siddha and the essence of body-mind connect, you can play a significant role in the integrative medicine. See the difference? Integrative medicine, alternative medicine, functional medicine, there is a difference. Integrative medicine is an evidence-based medicine which can incorporate any other streams of medicine like Ayurveda, massage therapy or some of the Siddha medicines or some yoga technique or acupuncture technique, whatever is best for the patient-centric approach it can adopt and practice. That's integrative medicine. Alternative medicine means, okay, you stop the English medicine and you take this. As morning sir was giving an example of insulin of 400, sugar of 400. So we'll give insulin first and then we try the Siddha medicine. Similarly, alternative medicine is you are replacing what is conventional and adding our medicine directly. So there what will happen? There is a add-on content between conventional medicine and complementary medicine. So if I make two circles, one is complementary medicine, another one is conventional medicine, the integration of these two can be called as integrative medicine. Functional medicine is the one which they say outside India, they say that the holistic perspective of a disease is not just a symptom treatment, but maybe what is deficient, sometimes magnesium might be deficient, calcium might be deficient, some of the trace elements might be deficient, give that trace element and then it will repair. So that is functional medicine. So integrative medicine on a global standard, the revenue post-COVID is very, very high. So if you focus your idea of integrating yoga along with Siddha medicines on a global platform, it will be much better for you. So another statistics, 80% of wellness programs, 80% anywhere you see the wellness programs, 80% of the times all the wellness programs are conducted by non-medical doctors. So this looks very simple, but it is a huge statistical significance where corporate money, corporatization, corporate social responsibility money, what you get from the workshops or employee assistance programs, majority of the people are non-medical people. So if you can take up the wellness along with your practice, you will be able to add up much better clinical practice than just doing it alone. Are you okay with my statistics? Okay. So WHO NCDs, non-communicable diseases, statistics says 41 million death every year. See that, 41 million death every year, which constitutes for about 70 to 80% of death between 40 years to 60 years. Around 70% of death between 50 to 70 years. In India, non-communicable disease statistics is around 68%. So 68% of the diseases are because of the non-communicable diseases, deaths. So it means non-communicable diseases, allopathy doctors including me, there are blindness. Allopathy doctors will come to the role only when the disease comes. You understand? I am talking on behalf of what I practice. I practice integrative medicine. I work with the corporates, but I don't work for the corporates. There is a difference. So, doctor who wants to be, who is a diabetologist, retinopathy specialist, all those doctors will come when the disease comes. Your role is much more, you want to prevent the disease. You can do a lot of contribution. Only little evidence base, what if you can add. So, it will cause a significant change and shift in the functions of the practice. I will give one example of one of the senior. He is Dr. Ramesh Rao, who is a veterinary doctor, who holds a PhD degree, who works on astrology and medicine. So his PhD topic was Kala. Kala in Islam, Kala in Christianity, Kala in Hinduism, Kala in Ayurveda, Kala in Siddha, all this time studies. So what he has done is Yamagandaka Kala, Gulika Kala, Rahu Kala, they have grown bacteria in a particular intensity, in all internationally acclaimed, accepted standards in Hebbal Veterinary College, 3000 acres of college. So he has published 16 research articles over the duration of 12 years. So when Veterinary and me were doing our Veterinary was in PG diploma in yoga therapy and I was in MD in yoga and rehabilitation. So there's a 3.5 years course and Veterinaries were around 1 year. During that period, this doctor was studying. His publications were so much profound that when we are saying individual, personalized, patient-centric approach, we are saying no, individual, personalized. In allopathy says, okay, common BP is so and so, you take this. You are having fever, take this paracetamol. So that is a generalization. That is not exactly right. So this doctor has publications, 16 research articles. They wanted to publish in Nature Journal. So I can share the soft copy with you. They did not accept the publications in spite of he publishing 16 research articles. Why? Because it will change the entire allopathy practices. Why? It is based on the time. So this person with this astrological background, born on this time and space, can get medicines, potency of the medicines will be working much better at this particular time. So that's what he is proven. You got my point? So in that sense, allopathy is more of the reductionist approach. In spite of you, they give you reductionist approach research also they will not acknowledge. The Siddha yoga or Siddhar medicine is a more of the holistic perspective. There is a consideration for mind, body, spirit. Mind, body, spirit. India can be a greatest nation to understand the philosophy of science of soul, Atma. Unlike any other Western aspect. If in India can stand for integrative medicine, all the Ayush doctors, if they can practice integrative concept with evidence based, they can bring the greatest changes on the global level. This is my small message. So with that, I'll give you simple evidences. For example, yoga increases deep sleep cycle. Proven. Yoga increases gamma aminobenzoic acid, GABA. It is proven. Yoga increases short sleep but deep sleep. Proven. Yoga can help you to control the HbA1c much better than just conventional medical practices. Yoga can increase intra-umbilical, when the mother and child, the umbilicus is there, umbilical artery. Umbilical artery and veins, blood circulation, blood vessel dilatation will be much better when the mothers are practicing breathing. You have just now done Nadi Shodhana Pranayama, that will increase the umbilical cord blood circulation. See the beauty of the research activities. Small one sentence I am saying, but for that one sentence they could have done a research of 2 to 5 years. There is a beautiful 3 people have significantly affected me turning towards integrative concepts. One is Dr. Herbert Benson. Herbert Benson was the first Harvard medical doctor who has done research on the Tibetan monks, how they do meditation. When they are doing meditation, say for example, this Tibetan monks will say, okay, I'll generate heat at the Anahata Chakra. You can find these things on YouTube. I can generate heat at Anahata Chakra. How to prove this? So this Dr. Herbert Benson has arranged infrared lights, and these Tibetan monks, just like example like Siddhar, where they got the Siddhis, and after Siddhi they have proposed the Siddha system. Similarly, these Tibetan monks, they wear their upper bodies naked, they are not wearing anything. They put ice water cloth on their body and they sit for meditation. Out of 10 people, some people say, I want to work on the Vishuddhi chakra, throat chakra. So the camera is focusing on the throat chakra. So only throat chakra infrared camera shows heat changes. So some set of monks practicing, or I'll work on Anahata chakra. So only chest area there is a significant heat exchange that he proves in his research activities. Still recently he was there. February he passed away. His one book is most beautiful book which you must read. Soft copy would be available on Google. Sometime you can find out. The relaxation response. You should write it down. The relaxation response. It means there is a release of endothelial nitric oxide when you practice some of the breathing techniques, some of the relaxation techniques. This endothelial nitric oxide will cause an effect which is opposite as that of stress response. When there is a stress, what will happen? Our heartbeat increases, our attention span reduces, our alertness increases, perspiration increases, respiration increases, the alertness increases, and there is a shift in the blood circulation. There is a hemodynamic changes. What will happen? Three systems, digestive system, reproductive system, endocrine system will get less blood supply. Hands and feet will get more blood supply for the flight or fight reflex. So the Dr. Herbert Benson has proven that there can be a relaxation when you do a deeper relaxation. There is something called as the deep relaxation response, that is opposite as that of fight or flight reflex or the stress response. None of the MBBS doctor can ever study this. So you understand what I am trying to share? So we are blinded with so much of technical knowledge of reductionist approach. We will, even Harvard medical doctor, Dr. Herbert Benson studies also we never studied. So that is a fate of part of industrial revolution, European industrial education system which we are into. So CME is like this, will open your mind towards the outer global perspective, how the so-called quote unquote scientists are using our own technology and they are giving back to us. With this example, when I went to China, to my surprise, I saw exactly the same Siddha concept in the name of traditional Chinese medicine. Even if somebody counts that TC much more older and all, it's so fine, it's good, but I feel there is a good reputation of Siddha style of work. In Kung Fu also, there is a Kung Fu and Kalde combination is a Kung Fu. Varmakalai is acupuncture, acupressure. Varmakalai, it is redefined. Varmakalai, if you can say medical knowledge, physiotherapy it goes, Varmakalai will become trigger point therapy, where there is a bulk of the muscle. Each muscle fiber has its own special nerve. When you press a particular bulk, if it is a trapezius,
இது முருங்க
press on the bulk
பூ
of
தான்
the trapezius, there is a trigger point. It will create a stretch reflex to the
தெரியும்.
Golgi
இந்த பூ
tendon
வந்து
apparatus.
அற்புதமான மருத்துவ குணம் உடையது. ரத்த சோகை இருக்கிறவங்க இந்த பூக்களை என்ன பண்ணலாம், கூட்டு மாதிரி செஞ்சு சாப்பிடலாம். இந்த பூக்களை பச்சையா கூட என்ன பண்ணலாம், தண்ணியில கழுவிட்டு காலையில வெறுவை.
Pain management, there is a mechanism of pain pathway. When you get hurt something, immediately I hold my hand to this or press it, the pain intensity reduces. Why? Because the pain and the touch sensation go the same path of spinal cord. Like two trains. One train is for the pain, one train is for the touch. So when there is a pain, touch, any holding hands or many touch can reduce the intensity of pain. There is a simple gate mechanism of, if you can write down gate mechanism, you might be knowing gate mechanism of pain. So another beautiful part,
இது முருங்க பூ தான், எல்லாருக்குமே தெரியும். இந்த பூ வந்து அற்புதமான மருத்துவ குணம் உடையது.
Most of the hand gestures, all the reflexology. So after the face as a part of your body, hands second part of the body which is maximum used for. Do you understand? So when we face is the first part, is the hand. So most of the therapies, if you say karate, Ayurveda,
இது முருங்க பூ தான்,
you use
எல்லாருக்குமே
hand
தெரியும்.
reflexology,
இந்த பூ வந்து
anything you say, you use hand. Modern medical correlation of that is number of receptors in the hands are maximum compared to any part of the body. Do you find it interesting? Mobile, type, motor and sensory homunculus. I made this class without people. Relax. So I'm trying to create wow factor because I want you to feel little alertness post lunch, and then I'll put you to sleep. So type sensory and motor homunculus. What you will see in the image, there is a depiction of picture where the hands are biggest, thumb is the biggest, second biggest part of the body is lips and tongue, and remaining part of the body is small. Do you see the same picture? Do you see that? Yes or no? Sensory and motor homunculus, HOMONCOLOUS. Could you get it? If you have a group, you can share that in the group. Only in Hinduism, next is in Buddhism, very rarely in other religion, uses hand for prayers. We do namaste. When you do namaste, there is a hemicranial synchronization. Left hand information goes to the right brain. From the right hand information goes to the left brain. When I folded hands together, the right brain and left brain can communicate much more through the corpus callosum. It is called as hemispherical synchronization. Did you hear somebody in any temple you are doing this? So what is this? It is tappu karanam. I did something wrong and I want to apologize in front of the God. Is tappu karanam? Looks like punishment in our tradition. Is it not? So it goes to the west. It will become, any idea? Huh? Super brain yoga. So tappu karanam is super brain yoga outside. So what it will do? There is an exact hemispherical synchronization. Right brain workup, left brain workup will be balanced. There are few examples, like very interesting. Nadi Shodhana Pranayama makes you feel the balance of right brain and left brain. Surya Namaskara will make you feel the balance of right brain and left brain. Chandra Namaskara will make you feel the balance of sympathetic, parasympathetic. Did you see some Siddhar or somebody putting a wooden stick underneath of this? Any significance of that? Any idea? Just like fun. Have you seen that? Old Rishi Munis, they'll keep one danda, resting hand either here or they'll put it here. So medical correlation is, if that Siddhar or the yoga muni or the sage wants to use more of the sloka based write up, more of the left brain activity, he will do Nadi Shodhana Pranayama if he or she gets into a stage of breathing practice where they can really do prana ayama. Prana is a vital force of energy. Ayama is the regulation. I can block the right nostril and or left nostril depending on my need of the right up. So right nostril is Surya Nadi, left nostril is Chandra Nadi. Right nostril is connected to the left brain, thinking, analytical left brain. Left nostril is connected with right brain. So does it look interesting? When I go to China, I say that this is Ida and Pingala is nothing but yin and yang. Yang is a heat, masculine male. Yin is cold, feminine. Similarly, concept of the body constitution is similar. There is some similarity between all these aspects. So when you go to traditional Chinese medicine, there is some similarity. When you study homeopathy, there is a body constitution. When you study Ayurveda, there is a body constitution. When you study Siddha medicine, there is a body constitution analysis. So one of my senior friend, I got to know him suddenly out of nowhere from YouTube. He only connected with me, Dr. Sudhir Bagga. He has done a beautiful research work. If you can see, he is very old now. Last life's essence, what he wants to do is make a device, maybe wristwatch kind of technology, where there is a technology of pulse oximeter, finger plethysmography technology, where it will give indication for Vata Pitta Kapha in the individual with all the background chart indicating all the system of medicine. Scienceoflife.com, you can check it. Scienceoflife.com. So I have the only copy in India, I have the only one copy. He is in USA. He is around 68 plus. If he dies off, all the idea goes out. So that I would like to share it with you sometime with his permission, or I'll be bringing him. So this makes you, does it make you feel interested? Second doctor is Dr. Tony Nadir. The first ever research in the field of yoga and Ayurveda seriously started during the transcendental meditation. Maharshi Mahesh Yogi. You are aware of it? TM meditation, you are aware of it? Transcendental meditation, you can write it down. Transcendental meditation movement. TM meditation, Maharshi Mahesh Yogi. There is one follower of Maharshi Mahesh Yogi by name Dr. Tony Nadir, who was MBBS MD, brain coherence study, neurologist kind of. He studied the Ramayana and correlated with nervous systems, nuclei of brain. He studied Patanjali Yoga Sutra. Patanjali Yoga Sutra is classical text of yoga, but for us it is a hidden Indian psychology. Hidden Indian psychology. There is no text in entire world which will depict about the normal state of mind, what are the normal emotions, what are the normal mind status, what is the chitta vritti nirodha, what are the mental modifications of the normal mind, what are the control system for the normal mind, how to control over this mental modification and attain the heightened state of supranormal mind. There is nowhere in the entire world except for Patanjali Yoga Sutra. So this Tony Nadir has researched on the Patanjali Yoga Sutra. There are 4 padas. So he correlated 4 pada, 196 slokas to the frontal lobe, parietal lobe, occipital lobe and temporal lobe. For this research he was awarded with 90 kg gold. Then he became successor of transcendental meditation. So now his name is some Adi Raja Maharaja. So this is all just a technology to make you feel motivated. Are you feeling motivated at this moment? If you say yes, I will stop. Okay. So I will give an example. Just now Vetri and you have done the relaxation technique. That is a part of Yoga Nidra. It is existing in our system from time immortal. But there is one doctor by name Dr. Jacobson from Canada. Dr. Jacobson from Canada. He has taken the essence of the Yoga Nidra. I don't know, he was angry with yoga or whatever. He has used only the non-spiritual aspect of Yoga Nidra and modified in the form of JPMR. Jacobson's Progressive Muscular Relaxation Technique, or Progressive Muscular Relaxation Technique, or Neuromuscular Relaxation Technique, NMR, JPMR. Any patients comes to you who have went to psychologist or psychiatrist, they say that okay, I practice JPMR. 75 to 80% of the world population, world's psychiatrists, psychologists use this technique called as JPMR. We'll practice that JPMR. Later you can read. JPMR is nothing but Yoga Nidra. But Western audience accept JPMR because there are more than 3,900 research articles on the JPMR. How it helps to reduce blood pressure, how it helps to reduce neck pain, how it helps to reduce back pain, how it will help to help the body's biorhythm changes. So no prayer, no breathing technique, no chanting, nothing. Just focusing on the awareness of the tightness of the muscles followed by relaxation of the muscles. JPMR. So with this, I'll give it a pause. I want you to tell me that do you want to practice this JPMR and then we continue study? So I have given enough content for your left brain to get overactivated, stimulated, or wow factor I have given you. Do you feel that wow factor or not yet? Do you feel no? We'll do 1 or 2 practices and then we'll, I want you to sleep actually. Do you want to practice this where I will put the lights off, or you want to practice where you are sitting? Yeah, your choice. Choice is yours, but all the chairs are also there. You want to use the chairs, I will tell you how to use the chairs. Don't want yoga mat. I don't want you to change your, don't want yoga mat also, fine. So you can use 2 chairs. There are a lot of chairs. Let us use the chairs. So I'll demonstrate how to sit down, sit on the chair. You can do that. Maybe one person can choose 2 chairs if they want, or 1 chair only. I'll show you. Come to the edge of the chair.
Dear participants, now you are going to perform Yoga Nidra practice, okay? So please kindly wear your yoga t-shirt and then you can lie down in the yoga mat. It will be comfort. Then only you can experience full effect of Yoga Nidra.
Will be comfortable.
Lights may be off. Switch off the lights. So after as it is a post-lunch session, parasympathetic will be very active. So you can practice Yoga Nidra.
See, those who doesn't want to lie down, preferably I want you to lie down. They can use these 2 techniques. One is this. Second one is take another chair. Yeah. So because you have a lot of chairs, you can do this technique. Which one you want? Lie down is better, chair is better. Choice is yours. Technique is very simple. Let us practice this once and then I'll give you this technique for your patients. You give this to your patient free of cost. I'll also give you a simple range of movement exercise, Sukshma Vayam exercises, what you did in the simple way. You can just give it to your patient. So I want you to consider and you are going to sleep. No other techniques. So only one simple technique. 5 seconds you are tightening the certain group of muscles. And then followed by 5 seconds you are relaxing the same group of muscles. This is first technique. Second, you just see me and see which muscles. You do that and focus your awareness on that muscle. So being aware of the tightness will change the body's biorhythm, and body will focus for deeper awareness, and there will be thought dissociation technique. Psychologically, your thoughts will get dissociated to something neutral. You forget your worries. You are worrying, thinking too much, you are ending up in migraine headache. You are doing this JPMR, migraine headache will reduce. Your sympathetic activity is high, blood pressure is high, blood glucose levels are high. You are dissociating your thoughts, something focusing on the neutral. Then your number of sympathetic overactivity reduces. All the time we are thinking. Some of your patients will also ask, sir, I don't know how to control my mind. All the time I am thinking only. So we have not exercised the mind to do the deviation or dissociation technique. So right now we are going to practice dissociation technique. It is incorporated everything. Psychological part is there, yoga part is there. I want you to experience. Lie down. You can lie down. Let's allow. You are going to sleep. So there are 13 parts of the body which we will be focusing. You can use, those people can use. You are comfortable with that chair, sir? You are not relaxed. I want you to relax really. Sitting on the chair also relax. Come to the edge of the chair. Hip should be at the edge of the chair. Neck should be relaxing. So this is a gift which you are going to transfer to your patients. All the patients you give, all the somatic patients, high blood pressure, insomnia, headache, agitation, depression, anxiety patient, you can transfer and practice. 13 parts of the body. Forearm first, biceps, triceps second, trapezius third, frontalis muscles 4, eyeballs 5, jaw 6, your muscles of the mouth 7, tongue 8, neck muscles platysma 9, chest muscles 10, stomach muscles 11, hip to till the knee 12, below knee till the tip of the toes 13 parts. So first part will do tightness for 5 seconds, relaxation for 5 seconds. Are you ready? Are you all ready? Okay. So get ready to experience progressive muscular relaxation technique, also called as neuromuscular relaxation technique. Very simple technique of focusing your body awareness of tightness of the muscles followed by relaxation. Get ready mentally. Make a fist of your hand, tighten your forearm muscles. You can look at me. You are going to make a fist of your hand, tighten your forearm muscles as tight as you can. All the anger on this new speaker, you can put it on your forearm. Hold your hands tight as possible. 1, 2, 3, 4, 5. Very slowly let go of the fist. Relax your forearm muscles. Put your all awareness on your forearm muscles. Feel the changes in the blood circulation. Very slowly and gently shift your awareness towards your biceps and tricep. You can look at me, no problem, absolutely. Your biceps and tricep, you are going to make both hands like this tight, biceps and triceps. Full tight, hold it tight in that position. Fold your, biceps, both hands. Hold full tight. 1, hold it tight. 2, 3, full tight. 4 and 5. Very slowly and gently let go of the tight biceps and triceps. Bring it back to the normal relaxing position. Feel and be aware of the blood circulation around your forearms, around your biceps and triceps. Very slowly and gently shift your awareness towards your trapezius muscles. Keeping your elbows straight. You can look at me. Raise your shoulders towards your ear. both hands, elbow straight, raise your shoulders towards your ears, hold it tight. Trapezius muscles, hold it tight. 1, 2, 3, 4 and 5. Very slowly and gently let go, bring it down and relax. Now the technique will become easy. Feel the wave of relaxation passing from the tip of your fingers towards the shoulders. Very slowly and gently focus your awareness on your forehead. Raise your eyebrows up. Hold your eyebrows up for 5 seconds. Eyebrows up. Frontalis muscles. 5 seconds. 1, 2, 3, 4, 5. Relax your forehead muscles. Bring it back to normal. Very slowly and gently focus your awareness on your eyeballs. Squeeze your eyeballs as tight as you can. Hold it tight for about 5 seconds. Squeeze your eyeballs, tighten your eyeballs. 1, 2, 3, 4, 5. Very slowly and gently let go. Relax your eyeballs. The wave of relaxation is passing down from the eyeballs towards the temporomandibular joint, TMJ. Make your mouth wide open, ah, for about 5 seconds. Feel the temporomandibular joint, mouth wide open. 1, 2, 3, 4, 5. Relax. Very slowly and gently focus your awareness on your mouth. Make your mouth in the form of O. Stretch your mouth in the form of O. Hold it tight. 1, 2, 3, 4, 5. Relax. Feel the relaxation of muscles of the mouth. Very slowly and gently focus your awareness on your tongue. Roll your tongue upwards within the mouth cavity. Hold it tight for about 5 seconds. 1, 2, 3, 4 and 5. Relax. Very slowly and gently focus your awareness on the neck muscles, platysma. Either extend your head backwards or pull the platysma muscles of the neck. So either you can extend, bring your head backwards so that you will stretch the neck muscles. Hold it like that for about 5 seconds. 1. If not, you can pull the neck muscles like this. You can look at me. Or extend head backwards. Okay. 1, 2, 3, 4 and 5. Done. Very slowly and gently shift your awareness to the chest area, intercostal muscles. In this, take a deep breath in and hold your breath for 5 seconds. Breathe in. Hold. 1, 2, 3, 4 and 5. Exhale. Very slowly and gently focus your awareness on your abdomen. Keep your both hands on your tummy, abdomen. Press it little hard. Make the abdominal muscles tight. Rectus abdominis muscles tight. Hold it tight. 1, 2, 3, 4, 5. Relax and let go. Bring your hands back to the normal. Very slowly and gently focus your awareness on the hip, quadricep muscles, hamstring muscles. Squeeze your buttocks, tighten your quadricep muscles. In the same lying down posture, squeeze your buttocks, tighten your quadricep muscles. 1, 2, 3, 4 and 5. Relax. Very slowly and gently shift your awareness towards the knee till the tip of the toes. Point your toes downwards. Pull up your kneecap. Hold the kneecap tight. Calf muscles tight. gastrocnemius, soleus muscles. Hold it tight. 1, 2, 3, 4 and 5. Majority of the work is done. Now it is an internal scanning. Keeping your eyes closed, focus your awareness on the toes. Say at the back of your mind that my toes are relaxed. Very slowly and gently, the wave of relaxation is moving upwards. My ankle, my calf muscles, my kneecap are relaxed. Biorhythm changes, sends signals to the brain. Brain secretes good amount of endorphin, enkephalin, Levy's P factor, and there is a stimulation of the relaxation response. Endothelial release of nitric oxide creates the exact opposite response as that of stress response, called as the relaxation response, what you are experiencing now. Very slowly and gently, my kneecap, my thighs, my buttocks are relaxed. We are not in hurry. Take absolute your own time to relax as deep as possible. Lower part of the body from the waist till the tip of toes, all the skeletal muscles are deeply relaxed. Very slowly and gently, shift my awareness towards abdomen. All my abdominal muscles, rectus abdominis, external oblique, internal oblique, transverse abdominis, all my back muscles, erector spinae, scalene, rhomboid, trapezius, teres major, teres minor, interscapularis, all the muscles are deeply relaxed. When the external muscles are relaxed, the parasympathetic dominance is enhanced. The organs will relax by increase in the blood supply to that organ. So visualize and imagine there is a good amount of refreshed, repairing, rejuvenating blood supply to the internal organs of your abdomen, which is into the parasympathetic dominance, and those organs are kind of repairing itself or healing. Therapeutic application of this one example I'll give. If somebody is having gastritis, focus your awareness on the stomach. Feel that gastritis is reducing because of increase in the blood supply and increase in the mucus secretion to form a layer in the interior walls of the stomach and preventing acid reflux. If somebody is having diabetes, focus your awareness on the pancreas. Feel that your insulin resistance is reducing because of the deep relaxation, and it is going to help you in diabetes. Anybody with hypertension, feel that there is a redistribution of blood from the sympathetic dominance to the parasympathetic relaxation, and my average diastolic blood pressure is reducing. Very slowly and gently focus your awareness on the chest. How beautifully the lungs and the heart work in synchrony. The greatest silent nature's wonder. How beautifully it incorporates supply of nutrient-rich blood to each and every cell of your body without fail, and how it will bring back the deoxygenated blood back to the heart to pump fresh supply of blood. Your all internal organs are deeply relaxed. Your back is totally relaxed. Upper back, middle back, lower back are deeply in relaxation. Feel the contact area of your body in line with the mat or the chair. Very slowly, the wave of relaxation is passing up. Your shoulders, your arm, your forearm, your wrist, your fingertips are deeply relaxed. Your neck muscles are relaxed. Your facial muscles are deeply relaxed. The muscles of tongue, mouth, temporomandibular joint, face, skull, all the muscles are deeply relaxing. From the tip of my toes to the head, all the skeletal muscles are deeply relaxed. At this point in time, I will use one sankalpa or an auto-suggestion or self-hypnosis that my body, my breathing, my heartbeat are in sync with each other. My body is in the deepest state of relaxation awareness. At this point in time, whatever I add sankalpa in my subconscious mind, it will be taken up in my involuntary nervous system and it will become true. So take one short positive sankalpa or an auto suggestion that related to you, anything. I want to start focusing on the balancing of body, mind, spirit, or I want to start focusing on my weight, or I want to focus on my anything related to you. Short, simple, positive affirmation. Repeat that affirmation at the back of your mind 3 times. One example can be, my blood sugar is going to become normalized because I am practicing deeper awareness and psychic sleep technique, something like that. My blood pressure, especially diastolic blood pressure, is getting normalized because I am understanding my body's biorhythm and changing the biorhythm and the blood circulation by this technique. Take all the time of yours, no hurry, absolutely. You are experiencing the mind cognitively, consciously, the conscious mind in relation with the subconscious mind. There is a window between conscious mind and subconscious mind called as semi-conscious mind. So this is a window of the Siddhar or the meditative masters where they send signal from the conscious mind to the subconscious mind to the nature to receive or to align themselves in the nature, and the nature reveals the secrets of the plant. Nature reveals the secret of the teaching, the secrets of the poison relieving techniques or the herbs which are used. These are all secrets will be revealed when the state of mind is beyond conscious mind and subconscious mind and reaches to the cosmic consciousness. Too much content, don't worry, let go, feeling. Take your own time. Observe the contact area at the back of your body which is in line with the mat. Your body's surface area is increasing because the skeletal muscles are deeply relaxed. The bioessence, biorhythm increases your aura or prabhavalaya or the biomagnetic energy of yours. This will increase your brain coherence, which will increase your awareness. That's why when you wake up after some time, you feel hyper intense sensory system. You feel more alert, more aware, more colors around you because of the heightened state of brain awareness. There is a profuse release of positive neurotransmitters, endorphins in the body, and you have the feeling of overwhelming emotional calmness within your own body mind complex. That is one tool to reach your inner healing mechanisms. Similarly, how the Siddhars would have gathered this greatest knowledge in their heightened state of awareness. Take your time, 1 to 2 minutes, enjoy the deepest relaxation in silence. I can see your faces are totally, deeply relaxed. Wonderful. Taking your own time, you slowly come back to your body consciousness. Gently move your toes a bit to indicate me that you are aware, awake at the back of your closed eyes. Slowly and gently move your fingertips. Feel the warmth of hemodynamic changes. You can feel the heightened blood circulation to the peripheries. Feel the alert mind at the back of your closed eyes, which has enhanced awareness, hypersensitive towards the sensory inputs. Very slowly and gently, you know the technique now. Turn towards one side of your body, keeping your eyes closed. Raise your one arm up, turn towards that side, taking support of the both hands without opening your eyes. Come to sitting posture as slow as possible, maintaining this relaxed awareness. There is no hurry, absolutely no hurry at all. Maintain this relaxed outlook, keeping your eyes closed. Very slowly and gently. No hurry at all. Be aware of your surrounding with your eyes closed. Very gently rub your hands towards each other. Massage onto your face, forehead, cheek, chin, front of your ear, back of your ear, neck muscles. Very slowly and gently open your eyes to the new world of relaxed awareness. You can on the light. Next 1 minute, you notice the changes around you. No need to talk absolutely. Notice the changes around you. What has happened, what you are perceiving in terms of your sensations. Sensation of smell, vision. Vision you will be able to notice. Auditory system, skin, colors. Any changes you can feel, let me know. So I tried to portray as technically, as medically sound as possible without using any technical language of yoga or Siddha yoga or anything. Did I use any Nadi Shodhana Pranayama? I did not use. So this is how the Western world uses our technology, gives it back to us. If you are not utilizing your skill of Western mind, of reductionist approach, at least a little bit for your own science and modify and give it to them back, they will give you back. So Nadi Shodhana Pranayama of India is coherent breathing technique of the West. So this is a anyaya or injustice on us, because it is our own technology which has been went outside. Intermittent fasting is a upvasa. All the religious people of India does upvasa, once in a week fasting on one or any other god based on their belief. Upvasa system will increase the apoptosis. Apoptosis will make the body rejuvenate better. So what you have experienced, the same will be experienced by the gut system when you are into fasting. So fasting is a part of tool, you can use it as a part of the system. Okay. I want one or two people to speak about your experience, otherwise it will become monotonous. I will be speaking and you will be listening. So let it be not a monologue but a dialogue where you also speak your experience. Any one of you, did you drift into the sleep for at least for short seconds? Some of you drifted into sleep for few seconds, yes or no? Yes, because our conscious mind is always aware of the one pattern which we do every day. I take out my conscious mind, surrender to the nature, nature will come in the form of sleep. Do you agree? So any sleep is nothing but conscious mind is surrendered to the nature, nature will come in the form of sleep. If somebody who is overthinking, the sleep will be disturbed, because you are consciously putting all the information in the subconscious mind, which is about 10% of your total brain capacity. We are not exploring the deeper part of the subconscious mind by any of these techniques, breathing techniques, meditation technique or simple techniques. These techniques may not be needed. Simply doing your own practice, being a mother, breastfeeding the mother can be meditation. Doing your cooking can be meditation, but be aware of the mind and what is the pattern of changes in the mind. If your mind is completely focused on cooking, nothing else you are thinking, that is meditation. If you are doing Shalla Chikitsa, if you are doing a surgery, you are completely focused on the patient, your hands are aware of your body mind complex is aligned, your hands will become magic. So surgery will become successful. If you are focusing on your study, completely your body mind complex are in line, your reading speed increases. Reading speed, when your children will say reading speed, number of words per minute. Some people will be having moderate reading speed, some people will be having fast reading speed. They can gather a lot of information in a shortest time because of these capacities. So any questions you have, you can ask me, otherwise I will take up something else. Did you feel this as a yoga nidra, or did you feel it as an westernized relaxation technique? How do you felt? So this technique is practiced in psychologists and psychiatrists, they will teach the same technique. This is called as JPMR, Jacobson's Progressive Muscular Relaxation Technique. When I go out in allopathy, I find very difficult for first 2 years, 2009 to 2011, I worked in Vikram Hospital free of cost to establish yoga as a tool for mind body. Very difficult. When I say JPMR, everybody does the JPMR. When they say Yoga Nidra, people don't want to do Yoga Nidra. So I found the language of convincing the Western minds by techniques like your deep cycle. Somebody does deep sleep cycle, sleep study. Their REM, NREM sleep pattern is changed. I will give you same Nadi Shodhana Pranayama technique. You can do some of these research. You have sleep study, sleep lab is there with you. Get some 10 patients who are having sleeplessness or migraine things, baseline study, 10-20 people, baseline study you do it, you give some Siddha medicines, whatever you, Manasamitra Vatakam, whatever you want to plan, Brahmi based combination, whatever you want to give them. Along with that, give a Nadi Shodhana Pranayama or left nostril breathing. Left nostril is connected with right brain. Emotional catharsis, they let their emotions out. Catharsis, emotions are reduced. then they can sleep better. Pre and post you do, you will see the significant difference in adding the yoga part along with your Siddhar. In addition to that, if you can add little scientific tuning of your words, all you can convince any hospital anywhere in the world. So during COVID time, the Siddha medicines has reached ICU. You understand? Ayurveda has reached ICU. In ICU, what can be given so that these COVID patients can recover? They have tried, they have done a lot of trials like that. When Sankata Bandaga Venkatamana, when you are in Sankata, you reach God. So when we are in danger, so we reach out to our traditional system of medicine. So post COVID, there is the greatest ever opportunity for all the online activities, greatest ever opportunity for phytochemicals and medical synchrony, how it interacts, how it enhances. So I'll give one example. If some medicines you choose in a particular day and time of the day, and you ask an apology for that particular plant and then take the plant and then process it, the alkaloid content, phytochemical content and potency of the medicine will enhance compared to same medicines. I just pluck it and process it as that of allopathy, the potency of the medicines will reduce. See the difference. So majority of the doctors from Siddha, Unani or Ayurveda, they are thinking like allopathy doctors. Okay, this medicine for this disease, okay, take this and give it to patient. It won't work. Unless you are approaching the mind part of the patient, unless you are approaching the detailed medical history, mind, how is the mind, what is the state of mind, mind is agitated, mind is in a stressful response, any amount of medications will not affect, because body will not be absorption phase. Same medication dosage for a relaxed person will be much better than the person who is in stress. So mind aspect is very, very important. So same one relaxation technique. Relaxation technique is one you practice, no? But application of this, how I make is, everybody used to laugh at me when I say I'll do yoga exercise prescription. I say I'll give prescription. What is a prescription? I'll do one breathing technique, one mudra, I'll teach you that. I'll say, okay, practice this breathing technique with mudra. For particular disease, I'll give particular mudra. I'll share that with you. And then I'll give for deep relaxation, JPMR you practice. If somebody is focusing on GERD symptoms, auto-suggestion part will
Sir,
be changed.
excuse me. Sir, in JPMR, auto-suggestion you are given, whether it will heal the disease in deeply?
It depends on, if I say
for regular practice or some duration more
heal.
than
Definitely, I'll tell you why.
a time.
I'll tell you. Very good question. Madam has asked, auto-suggestion, whatever you are giving in the JPMR, will it heal the disease? It will heal the disease, because auto-suggestion you are practicing, this is JPMR is only the little bit. I am adding auto-suggestion, sankalpa of yoga and a disease-based medical history. Somebody is having GERD. Imagine somebody is having ductal carcinoma of the breast, stage 3. Ductal carcinoma of the breast, stage 3. You imagine one bad cell with angry crying, I'll give this as auto-suggestion. The bad angry cell is becoming normalized cell. So cell wall shape is becoming normal. The next phase I'll say this cell wall becoming normal phase, then it is becoming happy cell. So anisocytosis, change in the size and shape of the cell wall can be changed into normal based on the mind status, because epigenetics says the emotions will modify the gene expression. Oncogene, cancer causing genes, cancer reducing genes, there are two genes. One by default, because of anything and everything under the sun can cause cancer. Anything, we'll all get TB, tuberculosis. Tuberculosis is not manifested, we might have got an infection already. Our body immune system will fight it and kill it off. Example. So like this auto-suggestion can work based on the subconscious mind. Number of thoughts will reduce. Body will go for parasympathetic dominance. Sympathetic overactivation, your sensory bombardment will be too much. I am having too much of mind, I am using my mind outside too much. My sensory sorry, my sympathetic tone will be high. Sympathetic tone is high, body goes for stress response. Body goes for stress response, as I mentioned, 3 systems: digestive system, reproductive system, endocrine system will lack of functioning. Less blood supply to the stomach. Stomach wall will become little either more hyperacidic or less of mucus secretion. There is a chances of gastritis or esophagitis. Less blood supply to the large intestine become less motility. Gastrocolic reflex will reduce. Gastro, stomach, colic, large intestine, reflex will reduce. Gastrocolic reflex will reduce, patient will go for constipation. So reproductive system, stress is too much, they will have decreased libido, erectile dysfunctions issues. We give medicines, just medicines won't help. If the person's maybe 58 to 60% of erectile dysfunctions are related to state of mind, relaxation response first, then medicines. So this is how, but it is the most neglected part. We do not focus on the mind at all, absolutely. We will say, I give this medicine, go to the psychologist. Psychologist is not needed. In my case, psychologist, physiotherapist, dietitian, exercise physiotherapy. I don't use these 3 people. I learned at my level, MBBS level, I consider myself as MBBS doctor only, because my MD yoga and rehabilitation is not accepted by Rajiv Gandhi University. It is not accepted because they don't want to accept yoga. But I say yoga increases your gamma amino benzoic acid, research proves, but they don't want to accept. So this is a difficulty of a modern medical doctor to get incorporated into traditional system of medicine. So I chose anything which is natural. Let it be Siddhar, let it be homeopathy, let it be Unani, let it be Ayurveda. I can adopt, incorporate and give it for the modern medical doctors with evidence base. This is how I practice. So Siddha, because I know veterinary for about 17 years before we planned all this. So he has grown in one direction, we have grown in one direction. So today we met again after 12 plus years, so physically. So you have any questions, you can ask, otherwise I can teach more. Based on your questions, you can learn more.
Dear participants, you can raise question.
Questions for 2 reasons. One, to test the resource person's knowledge. Second, to clear your doubts. So I will give you what I usually share it as the exercise prescription. I am sure that you have never practiced this or never done it before. Okay. So any disease, usually I will say, if you are having less, we will take it as an example, certain oxygen part of the body, there is certain level of oxygen for each body and certain level of glucose for each body reserved for all the cells. Okay. So imagine I am gaining lot of abdominal fat, and fat cells usually eat more oxygen and more glucose. If it is so, the reservoir for unimportant parts of the body like nail, tongue, hair will get less blood supply. Then the signs of disease, early disease, you can find out in the tongue diagnosis, what you have within. Tongue diagnosis you will be able to find because body is not focusing on those tongue. Body says the liver, brain is more important for me, let me focus my oxygen and glucose to these major organs, not for the hair, nail and tongue. So skin changes will be there much more years before, 10 years before any renal diseases, 15 years before, 5 years before, maybe skin changes will become more thick and more dark because of insulin resistance. Then you have to get your, Siddha based medicine, it is an intuition based medicine, and also there can be correlation of change in the metabolic activity. So with this example, as number of fat cells are eating more oxygen and glucose, I mentioned, stress is equal to, you can come back to your seats if you want, stress is equal to more pressure and less resources. Do you agree? How many of you are having knee pain at this age? Knee pain. clear audio. Some different distance. Okay. Where were we? So, number of fat cells. So, if I say the breathing or the peak flow rate, amount of oxygen which is going inside and amount of oxygen which is going outside, if the one person's peak flow rate can be increased, it will give you more reservoir for oxygen that can reduce the possibilities of disease. Do you agree with this? Any system of medicine you take, idea is because we are having different cells of the body eating more oxygen, more glucose. So, certain cells of the body, vulnerable cells, let it be stomach, let it be pancreas, let it be islet cells of pancreas, or let it be skin, any disease. Each one of us have, based on our genetic tendency, we have a pattern of disease which can come to us. That can be prevented and avoided if you increase your lung capacity. Smallest secret, never revealed. So, anywhere, anytime, any yoga practices anywhere in the world, breathing in is sympathetic activity, breathing out is parasympathetic activity. All the chanting, breathing out is more, breathing out is more. Om, exhalation is longer, exhalation is longer. Inhalation is sympathetic dominance, exhalation is parasympathetic dominance. So, great secret. So, what you will do for your patient? Any patient of any religion, based on any religion, secret is this: increase the exhalation of the person. Repetition, exhalation. If they focus on the exhalation and inhalation, their mind will get defocused. Kendrikarana, vikendrikarana. Focusing, defocusing. I focus on some Om chanting or focus on some symbols. That is a dharana, that is a focusing. If I focus intensely with all my resources at one point there is a defocusing techniques. The effortless focus will happen, that is called as dhyana. You are putting efforts to do focus. Majority of the meditation technique in the world is nothing but the dharana only. You are trying to focus on Om, trying to focus on Jesus, trying to focus on Allah, the cross, whatever. We are focusing on symbols. There we are doing dharana, dharana, dharana. Concentration. Concentration is with effort. With effort is logical mind, always. When you are intensely focusing something, there is a few moments of defocusing, awareness free, effortless focus shall happen. That is glimpses of meditation. Meditation cannot be done, it should happen. So similarly, I was discussing about increase your lung capacity can fight out with the disease much better than normal lung capacity. So same medicines what you are using in Siddhar format, increase the patient's lung capacity, increase the ability to defocus the mind, increase the ability to focus on the parasympathetic dominance of the patient, patient healing response will be better. Do you agree with this? Yes or no? Yeah. Any questions or no questions? So there are about, see, India is always invaded by Portuguese, Dutch, Mughals, all those people. So we lose our cultural heritage very easily. We can get influenced by Western medicines very easily. If I am given a chance of 10 people, get a scoring XYZ, number one scoring, what you will choose? If you ask, their first preference will be MBBS. Because psychologically it is there in our mind. Deep down we are all racist people, India especially. Deep down we have Western audience preference different. Western psyche or mind will be totally different, Eastern mind is totally different. Eastern thinking levels are different, very deep, internal world will be very focused. Western thinking will be more of the outwardly depiction. Allopathy will be famous in the West. allopathy will be famous in the East also, because we do not accept so easily. So what should be the pattern? This kind of hospital should be normal everywhere. So China it is happening. 1957, what is the Chinese leader? Mao. So there was a decline in the acupuncture phase around 1957 to 59 that time. So there was a cultural shift. So political influence was so high that they have given prime importance for traditional Chinese medicine and acupressure. Everybody should practice acupuncture, traditional Chinese medicine indigenously. So that is the rule. Government has set a rule. So that has worked after so many years. Now it has worked. If you see WHO's traditional Chinese medical specialties or any other complementary, traditional Chinese medicine, acupressure comes first. So what I mean is, place like this, government interest and inclination makes a huge difference in implementation of traditional medicines. So for the Tamil Nadu, traditional medicine is Siddha medicine. So it should be the primary medical specialty. So what I mean to say is, if I go to China, I go with all the Sinarest, Cefixime, Montelukast, all the medicines I will be going. If I get, my first experience was, I had a severe cold, I wanted to take Sinarest. So one Chinese doctor given me, there was this big moxie. Moxie is Agni Karma. In Siddha what we'll use some heat and we'll put it at the back. So they worked on some part of the nerve complex. I'll say nerve plexus, trigger points, marma points. You stimulate those marma points, there is a different release of endothelial nitric oxide, tumor necrosis factor, beta cells, plasma cells. There is a different release, and it will get healed locally without need of the medicine. That was my first experience. After that, I learnt traditional Chinese medicine, especially acupuncture, reflexology, other things for about 1 to 2 years. I used to go from here, teach yoga, Ayurveda, come back learning acupuncture techniques. So I incorporate. MBBS doctor doing acupuncture is very funny, is it not? So what I mean to say is, it needs your own efforts or government efforts to have a significant cultural shift to accept the traditional medical system as a main medical system. But it is sidelined. In India, what is happening? I'll give another example. Any one of you are having loan? Any loans you have? No loans? Medical loans you have not taken? If anybody is giving any loans, for example, Bajaj is giving you some loan, if they say MBBS, they given me 14.5% rate of interest, they are given loan. The moment I say I am a BAMS or I am a Siddha doctor, the rate of interest is 16.5. Check this. Why? Government should make rate of interest for Siddha doctor 9%. For MBBS doctor 14%, it's okay. Why MBBS doctor you want to give more preference? Even in the administrative side, because our preferences is that. So that's what, your interest is always important, but in Ayush department, there are 7,51,000 Ayush practitioners. There are about 13 lakhs allopathy practitioners. 75% of the patient's money is out of the pocket investment for the patient. 75%. 72% of rural population, 79% of urban population wants allopathy. So out of this 7,51,000, except for the people who are practicing in the government sector as a government employee, will be practicing Siddha. But check with your friends, are they practicing Siddha in a rural areas, remote areas, or are they practicing prick practice of allopathy? Tell me. Are they practicing, give injection, diclo, dexa, mix it, give injection, patient is recovered. Hey, doctor's hands are very good, he has recovered my pain just with one injection, and then give 3 days medicine. Then I give little Siddha medicine, it's fine. How many of your friends are practicing this? That is a livelihood, because there is no other option for us. So this is a painful part where usually I share because of the lack of government initiatives and lack of rewarding the traditional doctors. Traditional doctors should have fixed salary minimum of 1 lakh rupees. Then why they will not practice Siddha? Correct? Yes or no? So out of 7,51,000 doctors, the statistics is not very clear. More than 80% of the doctors who are in a peripheries will practice allopathy. So even though we are fighting, technically we are fighting with a different department. Mine is Siddha, yours is Ayurveda, somebody is Unani. Unani doctor is practicing allopathy. Homeopathy doctor is practicing allopathy. Correct? Siddha doctor is practicing allopathy. Ayurveda doctor is practicing allopathy. Majority of the times, majority of your, out of 150 students of your batch, how many friends are practicing what you see? That is your statistics. Somebody is 60% practicing mainstream medicine. Statistics says that. So how to enhance traditional values? By incorporating. I am just a Siddha doctor. If I am Siddha doctor, what I will do is, I will add the auto-suggestion technique, I will add the yoga techniques, I will add the psychosomatic technique, I will add the cupping methods, I will add acupuncture methods, I will add in my practice. Why can't I enhance the practice? Why to give? And India is a country for lot of claims. Somebody will claim, okay, I will give you some medicine, it will get cure, it will cure your cancer. You will not say that. You go in a systematic way of a diagnosis according to your study. There are in between people who are not studied anything. They are not a doctors, but you have seen in TVs, no? And one person takes a chair and beats at the back. Back pain is cured. 500 rupees consultation. 550 people are waiting in the line for getting beaten from the. You heard this? There's some Baba named that side, Raichur side. There's some practitioner who gives you some black liquid which is helping, they will apply something on your hair. Hair will come within 2 weeks. How it is possible? Your hair cycle only they don't know. Telophase, what phase of hair cycle they don't know. So what I mean to say is, you need to report these people who are practicing like this, and you need to enhance your additional skills. So now I'll teach you one therapeutic breathing technique. You give me some example of one disease you give me, and I'll teach you one set of technique which I use every time. So I want you to ask me one question, one disease, I'll give you one prescription of breathing technique which I designed by myself using Hatha Yoga techniques, claiming that increase in your lung volume increases the fighting capacity to fight with the disease. With less medication you can control the disease better. Did you understand what I said? I want you to ask one question, give me one disease. Any disease, common disease you give me. So what breathing technique you teach, sir? Breathing technique is same. I changed the mudra. So just it's funny because it is, I want to later part of my old age, maybe if I survive till 60 years, 70 years, I want to grow a lot of beard like Sadhguru, lot of beard, turban I want to wear. When hair is gone, I want to wear some turban, and then I want to teach that breathing techniques. Now I teach that. Give me one disease. Hypertension. So make your hand like this. One scientific evidence I have given, number of receptors are maximum in your hand compared to any part of the body. You agree with me? You agree with me? It is agreeable because it is a neurophysiology says that thumb has the biggest area in the motor cortex. There is something called as motor cortex and sensory cortex. If somebody is having stroke at the motor cortex, the opposite side of the body will be totally hemiplegia, motor cortex. So thumb has the biggest area. So thumb is Agni. Index finger is Vayu. Middle finger is Agni, Vayu, Akasha. Ring finger is Prithvi. Little finger is Varuna, water. So let me tell you, this is a kindergarten study. So what is this? Thumb. I am moving thumb. Fire. This one? Look at my fingers. Air. Middle finger? Ether or space. Earth. Water. So each finger there is a mudra. If your body, mind, spirit complex is enhanced, if you can reconnect your body in such a way, your breathing is very good pattern, your pranayama, you have done so much of pranayama that you can regulate your breathing much better, then your bioenergy of your body can enhance with the mudras. Normally doing mudra is just a holding fingertip, that's all. But if it is energized, if it is enhanced, that can really cause a difference. So now we have given hypertension. Hypertension, I want to reduce the vata by reducing the vayu. So I'll go with this. Can I come down or? So hold your hands. There are 4 secrets. One secret is each finger there is a one element. Thumb, Agni, index finger, Vayu, middle finger, Akasha, ring finger, Prithvi, little finger, water. So second secret is, if I touch this like this, it means I am balancing the Agni and the Vayu. So Jnana Mudra is balancing of Agni and Vayu. Agni can be your Jatragni, your metabolic system can be your Agni. So you are balancing your metabolic system by, so imagine there is a loss of chi or energy from the hand, from the feet, from the vertex. So applying some oil on the head, applying some oil on the hands, applying some oil on the feet, excess of vata can be reduced. Children are very hyperactive, you give some oil to apply, can be subtle energy changes, electromagnetic energy or a psychoneural energy or a biomagnetic energy or the aura can be enhanced by reducing the outflow of the aura, electromagnetic energy. When somebody elderly, we go and touch the feet. Why is so? North and south, south and north. When we touch the feet, their subtle bioenergy system which is embedded in their chakras, based on their upbringing, based on their practice, based on their sadhana, some amount of it will come back to us. So never touch anybody's feet which you do not know them very well, because you are going to grab their energy unless you know how to cut the energy off. So I am talking totally metaphysical, but also correlating with psychoneural energy. So doing like this is balance of Agni and Vayu. Third secret is, if I do like this, I am controlling, suppressing the Vayu by Agni. You got my point? I am reducing, suppressing the Vayu by Agni. So this can be called as Vayu Mudra. See the beauty? First secret is each finger has one element. You are okay with that? Second secret is, if I touch like this, Akasha and Earth, Akasha and Agni. So anything Akasha in the body, inside the body there is a space, outside the body there is a space. Emotional space, emotions embedded, this can help. Emotional conflicts, this can help. Your inner ear having problem, this can help, Akasha Mudra. Your intestines are having some more gas, this can help, Akasha, space within the space. But with that your body should be channelized, toned up by yoga. Your breathing should be toned up by regular practice of pranayama. Then the chi and energy will be so high that this mudra can help you in that organ. It is a hypothesis, but it is doable, it is agreeable, because I have given one hypothesis is number of receptors are maximum in your hand. When you are doing something, when you are doing Varmakalai, you are triggering the nerve complex, nerve plexus you are triggering is some part of the spinal, ascending spinal roots and descending spinal root you are triggering. That related organ might get stimulated, either it is increasing the blood supply or getting repaired better. Possibilities are there, it cannot be proven. Correct? So, how many of you have experienced acupuncture? How many of you are feeling sleepy? Tell me. I will wake them up in 20 seconds, I will wake them up. Okay. Everybody fresh. I am happy that because I feel I was little anxious because I don't know what to teach you. So all my teachings are all, or Vetri has already taught lot of, every content he taught. Then he asked while going, he says, Shashi, you just teach your eccentric technique of mudra, they'll enjoy. He told and went. Is it interesting or not? So first is 5 elements. 1, this is balance. Third is suppressing. Fourth one is, if I do like this, see what I am doing. So now you imagine more Agni, medium Agni, less Agni. More Vayu, medium Vayu, less Vayu. More Akasha, medium Akasha, less Akasha. More Prithvi, medium Prithvi, less Prithvi. More water, medium water, less water. So if I am doing like this, it is called as Aditi Mudra. Aditi is a detox mudra. Agni, fire and wood of the Chinese medicine, traditional Chinese medicine, fire and wood. If fire and wood together, wood will get burnt, correct? So earth element. So fifth secret is Agni in our body metabolic system, allopathy. Agni is metabolic system. Vayu is a dissolved oxygen in the body. Dissolved oxygen in the body. Akasha. Akasha is a space, ether, space. Earth, anything hard in the body, all the tissues, bones, all the ligaments, anything hard organs in the body can be earth element. Last one is water. Around 60 to 70% of the body is made up of water. Around 90% of brain is made up of water. So when the phase changes, when the moonlight comes, body energy changes, because our body energy is exactly like a ocean water. Body water is ocean water. So moon phase has a symptom on the brain of a person. Emotions will change, especially if women. Did you notice? You notice the psychiatric patients, moon phase have a change on the body. This side of the India are sun worshippers. The Middle East part is a moon worshippers. So they will be fighting all the time. See the difference where you can apply. So 7 Saregama Padanisa, 7 frequencies, 7 colors, 7 tunings. So each one of them has an implication on the body. So now I will teach you, if I do this, Jnana Mudra. Jnana Mudra for the increase in the attention span, increase in the memory retention, increase in the re-expression of the memory. Memory has 3 components, audio, video mixed. Some people can remember the face, some people can remember the names, some people can remember their voice, audio, video mixed memory. So when you are doing this technique, probably your emotional regulation will happen in such a way that memory retention can be much better. Possibilities are there. There is one research conducted on children for about 3 months. They are doing Jnana Mudra. Their attention span has increased. There is one finger tapping method. So there is one machine which will tap finger like this to test the frontal lobe functioning. How many more taps you can do. That can be done. So frontal lobe function, finger tapping method. They notice that the children who are practicing Om chanting or some of these Jnana Mudra based chanting will increase their attention span much higher than other controlled children who are not doing. So there are research, but we have to accept it, acknowledge it and tell it. The oil method, what you are doing for diagnosis, if you tell it to allopathy doctor, they will laugh at us. Correct? Correct? But there is a metaphysical entity. For them I will tell that okay, there is a research by Dr. Mosaro, Japan. Write it down. You know, there is a water crystallography study. This Mosaro doctor has, what he has done is, he put one glass of water, scald that water very bad. First you do a study of a water crystallography study. Study the structure of the water by water crystallography. Then note down what is the structure of water. Then scald the water structure. The uniform structure of the water will change. So that is a distortion of water without even touching the water. Again, if they play, then they played some 40 national anthems. The symmetry of the water molecules become perfectly symmetrical. National anthems. If they say I love you, the symmetry enhances. They scored bad, I hate you, I bastard, something you say, that water molecule changes. That is a research. So it means Ganga water, purity of the Ganga water is true. The holy water of Christianity is true. The Zamzam water of Islam is true. But we do not know how to take to that level. But we are fighting with our local levels and we are dying. So first one is Jnana Mudra. I will teach you 4 types of Jnana Mudra. If I am facing Jnana Mudra upwards, mainly adults will practice like this because we want to know the knowledge of the outside world. Iha Vidya Para Vidya. This world, that world. So if I am holding like this, I want the knowledge of other world. This world knowledge I already have. So upward facing Jnana Mudra is for adults, 5 to 10 minutes. All mudras can be practiced 5 to 10 minutes. If I am doing it down, for children who are just coming from that world, they do not know about this world. So for them, downward Jnana Mudra. Any children less than 6 years, downward triangle, Jnana Mudra. If I use the same Jnana Mudra like this, have you seen? Then it will become Dhyana. Dhyana Mudra is this. This is Dhyana Mudra. So if I use Chin Mudra like this, it is become Dhyana Jnana Mudra. DHYA Dhyana, GYA Jnana. Dhyana Jnana Mudra. If the same one, I will use it like this. This is a perfect example of Bodhisattva. Bodhi, Buddha's message is do not do the extreme, follow the middle path. This is a Buddha's message of life. He was into married life, he was also into sannyasa life. Then he chosen the middle path, then he got enlightenment. You know the story, no? You know the story? Buddha's story, you know, no? You know, otherwise you study. So he was in married man, he experienced married life, and then he was into spiritual practice, intense spiritual practice for more than 6 years or so. Then at one point of time he was very hungry, somebody gives him payasam. Then after that payasam he has that immediate letting go effect, and then he got enlightened. He was holding on to something. Too much of renunciation is also problem. Too much of bhoga is also problem. So follow the middle path. So this world knowledge, that world knowledge together, Bodhisattva Mudra. Correct? So you have given me example of BP. BP, I want to fold this finger, Vata I want to reduce. I want to touch the tip of thumb with the middle finger and the ring finger. Let the little finger be free. This is called as Hridaya Mudra. Hridaya Mudra. Western people, for Westerners, it is a 3-point technique. Westerners, if I go West, I will say there are number of receptors are maximum in this. You hold this technique, your bio coherence of the brain will change. I will say like this. I use technical words. I do not know. Will it change or not? I don't know. I have not done any research on this. But I claim that it will change, your brain wave coherence will change. Particular organ related to that will get a benefit. How they will get benefit? Parasympathetic dominance, blood volume of that area will increase. Blood, heart will get better blood supply. What better blood supply? Diastolic blood supply will be better. So with this, I will say, this is, what is this I told? Hridaya Mudra, heart, Hridaya Mudra. Hridaya Mudra, I will tell them a simple breathing pattern. 4 seconds breathing in, 4 seconds holding the breath, 4 seconds exhalation is my pattern. Westerns, they adopted this as a box breathing. Breathe in 4 seconds, hold the breath 4 seconds, breathe out 4 seconds, hold the breath 4 seconds. I use triangle. Breathe in, hold, breathe out. So when I am putting my mind into one kshana, in Sanskrit, Tamil, there is a one word, one moment, kshana, 1 second. So kshana can be 1, 2, 3, 4. Hold your breath, approximately put around 4 seconds of your thought. So let us do this practice. Do the Hridaya Mudra. Challenge in this is, if you are doing the technique right, you will not have any other thoughts. If you are doing the technique wrong, you will have other thoughts. So holding the Hridaya Mudra, I breathe in approximately 4 seconds, hold the breath for 4 seconds, 1, 2, 3, 4, then exhale. Exhale for 4 seconds. So 4 seconds breathing in, 4 seconds holding the breath, 4 seconds exhalation is 1 count. Let us practice 5 counts with this. So this is what I give. I took around 2.5 years to design this technique. I will tell you how. So let us practice and tell me how it is working. So breathing in, let us do. Breathe in 4 seconds. Hold your breath. You can keep it on your knee, keep it on the desk, no problem. Hold your breath for 4 seconds. Breathing out for 4 seconds. Breathe in 1, 2, 3, 4. Hold your breath 1, 2, 3, 4. Breathe out, exhale 1, 2, 3, 4. Continue the pattern. Breathing in 1, 2, 3, 4. Hold your breath. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4. Continue. Keep doing it. 5 pattern of breathing in, holding and breathing out. Breathe in, hold your breath, breathe out. If you are not able to do it exact 4 seconds, you do it as per your comfort. Breathing in for few seconds, hold your breath for few seconds, breathe out for few seconds. Notice that your mind, the monkey mind usually will say, that somebody has done a research on this. There are 50 to 60,000 random thoughts, conscious, subconscious, sleeping, dreaming, all inclusive. I do not know how they have done the research, but so somebody who is having more number of thoughts, their sympathetic tone will be high. Correct? So for them, cutting down the pattern of too much of breathing, I can use, too much of thoughts, I can use this thought dissociation technique like this. Breathing in, holding breath, breathing out. So you write down as a prescription, RX prescription you write now, take a dose. 4, 4, 4 breathing technique with Hridaya Mudra, 20 times morning, 20 times evening for first 1 month. This is my prescription. Everybody laughs at me, all the time they laugh at me. So 4 seconds breathing in, 4 seconds holding the breath, 4 seconds exhalation. 4, 4, 4 pattern is, you write it down. Along with that, Hridaya Mudra for BP approximately 20 times morning, 20 times evening for 1 month. Second month onwards, I will tell them 6 seconds breathing in, 4 seconds holding the breath, 6 seconds exhalation. 20, 20 for second month. What is happening? If you check the person's lung volume, especially peak flow rate, PFR, can be tested with simple spirometry, allopathy. Modern medicine, we all the people, we should not separate, segregate. Use the modern diagnostics as much as we can to prove the traditional methods. So always mind should be open for integrative medicine. Oh, spirometry, it is allopathy, I don't want to use. No, please use it. Like homeopathy, what it does? Homeopathy, from anatomy till the treatment, everything is copy paste from allopathy studies. Only treatment will change. Unlike traditional system of Ayurveda and Siddha, there is a detailed study, detailed workup. Homeopathy, it is not like that. So actually speaking, in India, Ayush department, we should have less people. Naturopathy should not be there. Somebody will hit me if I go out. Naturopathy should not be there. Naturopathy is traditional Chinese medicine. You are putting acupuncture in naturopathy. It's not naturopathy. Siddha includes naturopathy. Ayurveda includes naturopathy. Why you want to have a separate naturopathy department? Because you do not want to promote Siddha. You do not want to promote Ayurveda. That's a pattern. That's a background mind. Naturopathy should not be there. Unani is not our exact science. It is somewhere else. So traditional, as Vetri was saying, technically Ayush department should promote more of Ayurveda, Yoga, Siddha maybe. Indigenous medical system we can promote. Why are we promoting outside techniques? Hijama techniques we are promoting. It's all Indian, it's all culturally it is from here, it went outside because we forgot, we are busy with fighting for freedom fight and other things we are busy. Somebody has refined it because they had a time and energy. They given it back to us and we are adopting it back. So sorry for that comment. Where I was? 6, 4, 6. Third month onwards, I will say 6, 6, 6. Breathing in for 6 seconds, holding the breath for 6 seconds, breathing out for 6 seconds. At least this person who is practicing breathing technique like this, his emotions will be under, his or her emotions will be under control, anger will be under control. Because you are doing deep breathing, holding the breath, breathing out. So later I will say, okay, if you are successful till this 3 months, then I will say breathing in, holding, I can reduce a little bit, 6, 6. Exhalation I will increase to 8 or 10. So that is my pattern of usage of breathing technique for a therapy. Somebody is anxious. So Agni, see this. I want you to practice this. Agni, interlock Agni, put it on the chest. What it looks like? Bird. Agni, I want to interlock this. Okay, somebody says, okay, this is not a good technique. I'll tell you psychology behind this. So thumb is interlocked. Focus the awareness of blood circulation around the thumb. You are focusing the awareness of blood circulation around the thumb. You feel the heat. I want you to do this technique. This one you can avoid. So this looks like a beak of an eagle. That's what it is called as Garuda Mudra. Hold it like this on the chest. So I'll give certain examples, casual example. I'm leaving this hand. If somebody is afraid suddenly, where their hand goes, suddenly you are of your hands in front of your chest. See that, feel it. Change in the resonance, changes the blood circulation. How you feel? Change in the heartbeat you will experience by this Ukara technique. Practice for five times. Let us see. Take a deep breath in. Feel the heartbeat. Resonance will induce relaxation, but heartbeat increases. There is something different, something is happening. Take a deep breath in. Two more times. Take a deep breath in. Last time, take a deep breath in. It looks funny initially, no problem. Take a deep breath in. Normal breathing. Feel, is there any change in the blood circulation between the thumb in the form of warmth? So gently open your eyes. I want you to unlock this finger and feel, without touching it, feel the warmth of your own hand towards other part of the skin. Do you feel little warm? So that is the best example for prana shakti can be enhanced or reduced by breathing technique, pranayama technique or sound resonance technique or by medicine. Each one works on the vibration. So everybody does Sri Yantra. It is a pattern of what is it, crystalline symmetrical structure of the universe. So that symmetric, everywhere there is a symmetry. Everywhere earth is made up of silica. Just check the percentage, I don't remember, maybe 29% of the earth has a pure silica. 79% plus of the earth has a silica mixture with other chemicals. So silica is a purest form. So each stone has, it's a crystallography study, there is a symmetry. Loss of symmetry is a disease. Bringing the symmetry back to the body is curing the disease. So you can use mantra, yantra, tantra, all the water you can use for healing, all the oil you can use for healing, all the kashayas, that too locally grown. So one area of the, if I say Chennai has its own specific geographical, herbal contents. Siddha medicines are different here. Some part of other parts, if I go to Kanyakumari, there will be different part of the medications, different. So each one I need to know it and apply it. So ultimately coming back to the essence is, when I say Siddha Yoga, it already means the two greatest Indian traditional medical systems, Ayurveda and Siddha, have its a spiritual essence. Without spiritual essence, if I want to disconnect, Western mind always wants to disconnect you from the essence. They want you to practice like allopathy. There only we are failing. So unless you add the spiritual essence, unless you add the yogic essence, this will not be complete. Because it is a holistic perspective, not a reductionist approach as that of allopathy. So we cannot practice, say this element is working on this gene. There are research happening, but we cannot conclusively say, because the understanding of knowledge is not just the logical, but there is some amount of intuition is there. Doctor will feel, this patient has something more based on this tongue diagnosis, I will say something more. I want to add this medicine. So there is a part of intelligence and intuition. I always use intelligence and intuition. That is an example where right now I am not using intelligence. Right now this is the only flow of my old studies, whatever I studied some time ago, I am not even recollecting. Because of you are showing more interest, I am teaching more. Same class, if I go somewhere else, if your face is like, how much this fellow is eating our head, means I will teach less and I will run away. So I have problem with PowerPoints. PowerPoints will become stuck. When you ask question, I will become more. So this is a Merudanda Mudra. Somebody is having a spine problem. Chinese medicine or the Kalaripet of this Kerala or Varmakalai of Tamil Nadu represents, there is a part of the body which looks like the spine. There is a holographic image of entire body in each gene. Our DNA has the entire body structure. So my thumb, which is extended thumb, looks like a spine. This is called as Merudanda Mudra. Merudanda Mudra. Somebody is having neck pain, back pain, I will ask them to do Merudanda Mudra, stretch, extend the thumb backwards and do the 4-4-4 breathing technique morning, evening. Second month 6-4-6 morning, evening. Third month 6-6-6 morning, evening. Mudra change, breathing pattern is same. How come it is going to help you in back pain? Maybe, I do not know, I am not a scientist, but maybe hypothetically I will say, I am extending the thumb backwards, there is a stretch reflex, stretch signal is going to my brain is forgetting the pain signals and catching the stretch signals. Because of this, my low back pain muscles might get relaxed. Allopathy, you give muscle relaxant, it will get relaxed very fast. I will give stretch reflex, I will hold this extended for little longer time. Stretch reflex is happening. In the stretch reflex, stretch reflex, Golgi tendon apparatus stretch, there is a reflex mechanism. It will go till one can go till the spine, another will go information till the brain. If I am just touching the a thorn or the candlelight, my half of the body only works. Brain even doesn't know. Without knowing only I take my hand back, reflex mechanism. So there could be some reflex working happening because of this stretch. That is my hypothesis. If somebody asks Merudanda Mudra with breathing pattern, I want to regularize breathing pattern because it will reduces stress response. Signaling of the stress chemicals from the adrenal glands, it will reduce. Adrenaline, noradrenaline secretion might reduce if your breathing is regular. Do you agree? If you are angry, how is your breathing? Fast, irregular, erratic. If you are very calm and relaxed, how is your breathing? Regular pattern. So does it means that your emotions are related to the breathing? If I correct the breathing, can the emotion be corrected? Of course. So beyond this, we should not give evidence to any scientist or allopathy doctors because they don't, some people don't understand. Some people don't want to understand. So they themselves will be taking Siddha medicines at the back, they will be requesting their Siddha friends, say, I have constipation, give me some medicines. They will be taking. But when you attend any conference and all, they say, oh, no, they have high chemicals. Same purification method, you use mercury. If the processing of mercury at a particular level happens, the mercury poison or semi-poison Vishaya and Upavisha. In Ayurveda there is a concept Vishaya and Upavisha. In Siddha also there is a concept of Vishaya and, so you are using poison as a medicine, rasa preparations. But the way it is used, the way it is prepared makes a difference. The medicine will have significant therapeutic effect the way you prepare. So how to tell this to allopathy minds? You know, so what you should do is you should not try to convince allopathy doctors, but you should convince with your own research activities, molecular studies, immunological studies. You do it, immunological study, IgM. What are the changes with IgE? If I give amla based medicines with rasa preparation, what will happen? So like that you can study. I will give a pause for a few seconds because I am talking more and you are not asking me any questions. You can ask. Any questions? Or if this class is motivating for you to take up more yoga, more mind body techniques, for me it's enough. So like this technique, have you studied any time this one? Never. Garuda Mudra I use for anxiety, I use this more. I say okay, I asked you to do 5 times. For anxiety depression patient I will ask them to do 20 times morning, 20 times evening. Resonance is going to correct some patterns. Okay. No, anything based on their question answer, I can answer. Mudras I can teach more. There are 729 mudras, but for them based on their questions I can answer. It's hardly 45 minutes. Okay. Madam is requesting for a tea break. Let us have a tea break. During the tea break you just think what are the questions you can ask.
Dear participants, now we can have a short break. So actually what SAR feel is, so when you raise question from that you will proceed further. That is the thing. So have a break, have a tea and then you come with all the questions. Thank you.
Okay, Ramna?
Yes, sir.
If it motivates them little bit, I'm fine. of traditional Chinese medicine, Srotas, the energy Srotas channels of Ayurveda, trigger point therapy of physiotherapy technique, and the bioelectrical signalings of whatever aura, energy, chi they will call. I want to correlate similarities. Allopathy is more of a nerve plexus and how the changes can happen. So I want to show how the technique can be utilized equally. So when we are segregating and practicing separately, it is very good to practice initially. Once you have become Siddha doctors, you should be open to receive new skills and apply for your patients. So how the people have evolved? Chinese, this comes from China. We are not evolved to that extent. Show me your hands. You trust me? No pain. This I use for you. This later you can try.
Capture on video and display the stage.
So I want you to feel what energy changes happens around the acupuncture points, how you can describe based on your study of Siddha. Is there any energy changes, is there any chi, heat changes, how do you describe? So usually this side of the skin is a female in traditional Chinese medicine, this part of the skin is male, yang energy is male, soft, this is yin energy, female. So they feel energy changes can be cause of disease. So by channelizing the energy certain areas, you are energizing the channels and then your energy channels will be better, energy channels, nerve pathways are better, disease will heal. Same like Varmakalai. You relax. Don't think there is a needle, forget it. So another explanation is there is an analgesic effect can be induced based on the thought. If I say that there is no pain, she will not feel the pain. Analgesia can be achieved by the thought process. Somebody asked me one question, no? Can it help? First or same? I already pick. Sure. Okay. Okay. What point of any Varma point you feel? You know? Parle. Continue. Anybody good in Varmakalai? I am not good. So to get quick, you can, but I can wait and see. So it's only left to you. If you want, you can do. If not, I'll continue. 5-10 minutes. Want me to teach more? I can teach. Based on your questions, I will move ahead. You can take it. See, needle removing, just remove quickly, there will not be any blood. Casually I put, where there is no superficial nerve, I put. So depending on your knowledge of Varmakalai, that area can be identified with the Nadi Pariksha machine, where if I do this Nadi, I follow this, I cannot feel this. But if I there is a Nadi. So this is LI4. So there is a lateral side, there is a, you can sit down. You can sit like this. So there is a large intestine, stomach 36 point here. What Varma point you have? So is more, I can use Vayu Mudra. Vayu Mudra, all the mudras can be used for thought reducing technique. You just give it to them, okay, practice, you do practice, it will reduce, you just tell the patient trust you and practices, at least their number of thoughts reduces, parasympathetic dominance enhances, your medicines will work better. Vayu Mudra. So this is Akasha Mudra. Knee pain, ear pain, complex emotions, stomach issues, irritable bowel syndrome. Sometimes there will be loose motion, sometimes there will be constipation, irritable bowel syndrome. Anywhere there is a space issue, emotional space. So somebody says, on Facebook they mention relationship, married, single, or they'll also mention complicated. For all complicated relationship, you can use Akasha Mudra. So next is this Prithvi Mudra. So Agni and the Prithvi are balancing. If you are balancing, it is for weight gain. Somebody who is very thin can be used for weight gain. Somebody who is not decisive, their emotional decision is not very good, so they can use Prithvi Mudra. If I change this, there is a research on this. So this is called as Surya Mudra. Surya Mudra, Prithvi is reduced, covered by Agni. Prithvi Mudra Prithvi Mudra, only same 2 fingers. If I use like this, Prithvi Mudra. If I use this way, Surya Mudra. Surya Mudra increases basal metabolic rate. It increases fat oxidation. So used for hypothyroidism, hyperthyroidism, parathyroid related issues, metabolic issues, endogenous obesity related issues. I tell them do Surya Mudra 5 to 10 minutes per day and right nostril breathing. Only breathing from the right side of the nostril. Right side of the nostril breathing, there is a research which says that right nostril breathing increases systolic blood pressure, increases fat oxidation. So if your blood pressure is under control, you can use SAV, Surya Anuloma Viloma Pranayama. SAV, Surya Anuloma Viloma. You do the same Anuloma Viloma. In this you hold this and only breathing in, breathing out only from the right. It's called as Surya Anuloma Viloma Pranayama. So many metabolic diseases, depression, anxiety, depression, hypothyroidism, metabolic issues, PCOD issues, obesity related issues, I use more of right nostril breathing. SAV, Surya Anuloma Viloma Pranayama, 40 times morning, 40 times evening. Surya Mudra, 5 minutes morning, 5 minutes evening, along with your medicines. Correct? So last one is Varuna Mudra. Varuna Mudra is a beautiful skin. It is a turgidity of cells, water content. Kidney skin, any kidney element, somebody is having creatinine 1.39 near to some acute kidney issues are there. There you can use acupuncture, you can use mudras. It will help little bit. When non-medical person is saying, okay, acupuncture this is going to cure all the disease. Somebody says, no. It will help you maybe 5%, 2%, 3% if you do it more properly, maybe 10%, not cure. Along with that, whatever need to be done, do it. So somebody is having asthma. Asthma, there is a less space. I want to fold both the middle finger, touch towards each other. This looks like the lungs tree. Looks like bronchioles. These two looks like bronchi. Correct? So it is called as, I don't know what is the name in Sanskrit, Asthma Mudra. Asthma Mudra. Because you are working on the middle finger, folding together, balancing, there is a space balance, lung space will be balanced. When you are holding like this, my arm is raised. I am having more space at the apical area of my, apical part of my lungs are aerated better, can be said. So there is one more technique. I want to reduce the, what is this? Water element. I want to reduce the water element using the fire. I want to balance this earth in the middle of the fire. I want to balance the sky, Akasha and Agni. Akasha, Agni balanced, Prithvi reduced into half, water reduced fully half. So this is bronchial mudra for any upper respiratory problems. I use this bronchial mudra. So with this mudra, breathing technique is same, 4-4-4, 20 morning, 20 evening. Second month 6-4-6, 20 morning, 20 evening. Third month 6-6-6, 20 morning, 20 evening. Later on, you can remove. You want to remove? Remove. So after acupuncture, 1 hour, 6 hours, 24 hours, there will be some difference that we need to see. First 1 month of Chinese acupuncture, they only given me work of removing the needle. They will put the needles, I will have to just stand and watch. First 10 days nothing, just I have to watch. Then later I have to remove the needle, that is only work for 1 month. No. No, I don't agree. My mind won't agree. See, like this, allopathy mind won't agree so fast. So there is a point I used which is near to the tennis elbow. He says that it is no pain. Maybe he is hyperactive mind where he feels that he is getting cured. That feeling might be there, that has helped him to not to perceive the pain. Maybe, I am not sure. Maybe little effect of acupuncture may be there. Maybe 10%, 20%. Again it will come back. So this wow factor you can create. Are you convinced that along with your routine studies, if you can incorporate cupping therapies, all other therapies, acupuncture, acupressure, Varmakalai therapies, you practice, you be confident. If you are not confident, at least under the nerve you feel what are the nerve plexus. Near the nerve, if you are pressing somewhere, there will be some trigger point. That can be identified with that machine, or you can also feel. If you can anatomically, if you are very good, the peroneal nerve is there. Around the peroneal nerve, there is a, we'll say this is a Janu Marma. Janu Basti you will do, no? Ayurveda they will do Janu Basti, Kati Basti, Griva Basti. So behind that there is a peroneal nerve. Around the peroneal nerve there are some pressure points which can help to stimulate Janu Marma. So like this you can correlate and study. So this is if you are motivated enough to expand your knowledge and use yoga as a technical tool for psychological somatic symptoms and other symptoms for your patient's betterment, the purpose of this class is served. Okay. So thank you very much. If you don't have questions, if you have questions, whatever, ask me. So my inside it depends on your response. Thank you very much.
So இன்சோம்னியாவுக்கு என்ன முத்திரை பண்ணலாம்
சார்?
தூக்கம் வராமல் இருக்கும் இன்சோம்னியாவுக்கு என்ன முத்திரை நல்லா இருக்கும்?
Insomnia, I use multiple mudras. Depends on what exact cause of insomnia. Is it not getting the sleep, or once you wake up you are not able to sleep? So what? I use JPMR. I use this Jnana Mudra. I use. So also depends on Samana Mudra. All the 5 elements all together. Samana. Everything is balanced. So Samana Mudra, or it is also called as a Mukula Mudra. This also can be used. Samana Mudra can be used, or Lotus Mudra can be used. So last Varuna and Agni and Varuna balance. Lotus Mudra in front of the heart. Yes. But usually if I say some patients you do like this, you will get sleep, better sleep, the patient will laugh at us. But if I write medicines and then I'll ask them to do this and practice, sometimes they'll say, some 10 times they'll laugh, but later on the doctor might be telling right only, they'll practice. Samana Mudra can be practiced. So there are around 729 mudras. So it was the Nalanda, Takshashila, that area, there are many mudra books have been lost. So mudras are divided into yoga mudras, puja mudras and dance mudras. So whatever we are practicing doing now is no dance mudras and no puja mudras. It's only yoga mudras is what we learn. I can teach around 550 mudras and correlation to the technical details I try. But usually this science is already dying, like Nadi Pariksha is dying. So it has to be revived and the people has to get together and learn. Okay. Thank you then. If you don't have questions, then I'm done. Madam? Merudanda Mudra. Yeah. Thumbs up. Thumbs up is Merudanda Mudra. So in this focus is extend the thumb backwards, hold it straight. Extended thumb. Just thumbs up is simple. If I extend more, there is creative tension here. That will trigger the stretch reflex. Merudanda Mudra.
Any other questions? Sorry, please be seated, sir.
It's okay.
We can give a great round of applause to our distinguished resource person, Dr. S.K. Shashikant sir. Thank you, sir, for being part of this CME, which is conducted by Department of Siddhar Yoga Maruthuvam. It was an excellent presentation, sir. So the presentation, it highlighted the integration of knowledge of allopathy, Siddha Yoga Muttiregal, and then Yoga Nittirai, and then traditional Chinese medicine with global touch. And SAR's presentation, it highlighted basics of Yoga Muttiregal. So, on the 5 fingers, 5 elemental theory. So, I think we can recall thumb another. Index finger, middle finger, okay, ring finger, and then little finger, So they have understood everything, sir. So the combination of these fingers, it leads to different various mudras, which is indicated for various disease management. So that is the concept. So it was a very nice presentation, sir. And then also the demo, practical demo of yoga nithirai. So அது கிட்டத்தட்ட நீங்கள் ஒரு ½ நித்திரைக்கு போயிருந்தீங்க எல்லாரும். What is your experience regarding that? I think anybody can share. ஏன்னா because you people experienced. அது நான் சொல்ல முடியாதுல்ல. கோபிருந்தேவிங்க. கலையரசி. Dr. Kalayarasi, please share your experience. Actually, myself and students, we were நாங்கள் சொல்லிட்டு இருந்தோம். ஸோ நம்ம அதில் இருக்க முடியலையே. ஸோ வி ஆர் கோயிங் இயர் அண்ட் தேர். ஸோ இருந்தால் நல்லா இருக்குமேன்னு தோணுச்சு. பிகாஸ் இட் வாஸ் வெரி ப்ளசன்ட். லைட்ஸ்லாம் ஆஃப் பண்ணிட்டு சார் வாஸ் இஸ் கிவிங் த கமாண்ட்ஸ் அண்ட் யூ ஆல் வேர் டூயிங் சம்திங். ஸோ வாட் இஸ் யுவர் எக்ஸ்பீரியன்ஸ்?
Actually, after taking a meal, it was
so
good to do.
So the parasympathetic system it will be very more sound.
Yes, ma'am. Especially after eating is so good for us. Yoga Nitra, actually, நீங்கள் சொன்ன மாதிரி 10 to 15 minutes ஒரு நித்திரையில் இருந்த மாதிரி தான் ஒரு ஃபீல் இருந்தது. That was so good.
Thank you, doctor.
Thank you.
So with this, I welcome Dr. Rajamma Devi Sorubarani ma'am. She is professor in the Department of Nanchu Maruthuvam, to honor our respected resource person. Thank you, ma'am. Thank you, sir. வாங்க ஜெயசித்ரா வாங்கிக்கோங்க. ஜெயசித்ரா அங்கேயே இருங்க, முடிச்சதுக்கு அப்புறம் ஹெல்ப் பண்ணுங்க சார். அதை பேக்ல போட்டு கொடுத்துருங்க. Thank you, sir, for your immense presence in this CME. With this, today's session ends. I request all the participants to stay back. Kotishwaran sir will come regarding your TA bill. So please stay back. Thank you.